వచ్చేయండి.
Hello, sir. Today I have a small doubt.
Come.
Sir, the diabetic patient who is following yoga, his pancreas performance will improve by doing yoga. Can you give your word
And
on
it
it?
will cure the diabetes.
Yes, sir.
So that was the talk.
Yes,
Close,
sir.
no? You are very close. Okay. See, anybody is saying, yes, certain yogasanas would be helpful, but that is not going to increase your pancreas, function or pancreas capability. It would produce more insulin. Actually, this is erroneous. In the first place, people do not understand what is the difference between type 1 diabetes and type 2 diabetes. See, type 1 diabetes is autoimmune disease, generally happens in the very early age of the early age, maybe by 10, 5 years, 6 years, like they have. But there you definitely need insulin. That means their pancreas is not producing insulin. So it's a very different case altogether. We should call them as actually that is diabetes. Whereas people after when they started having these wrong habits over the years, they start developing overweight first, then cholesterol, then fatty liver, and then pre-diabetic and diabetic. Now, by the time a person has become diabetic, that means what? His pancreas is working very hard for years and decades. Type 2 diabetes is not a problem of less insulin. The type 2 diabetes is actually more insulin in the body. Suppose a person is already diabetic, his pancreas is producing more insulin. As per the theory, if you do this yoga, if it is still making more, it will become worse. Not that you should avoid asanas. It does not have a direct correlation. So what is the best way? Why we are getting diabetes? First of all, diabetes people will get after some of the people after the overweight, cholesterol and all that. So once you are diabetic means you need to check few things, very very important. Lot of people only check fasting sugar and PP sugar. They say, oh, my sugar level is 126 and my PP is of 200, so I am diabetic. Yes, that is one indicator, but the best is your HbA1c. If HbA1c is above 5.7% means pre-diabetic, above 6.5% means diabetic. But then again, fasting sugar, PP sugar are, depends on the previous night. Suppose previous night you ate less or you ate low carb food, that obviously sugar will be low. That is not a clear indication for the diabetes. What has to be checked is your insulin production. You must check what is your fasting sugar, what is your fasting insulin, what is your HbA1c. And in some cases you have to check what is your C-peptide. These are the four indicators to tell you very clearly where you are. See, some people have HbA1c 10%, some people maybe 7% HbA1c. But their pancreas is working differently. So the best thing is you have to analyze it. So now again, one more important point is, my friend has followed this, he got rid of his diabetes. Another fellow says he followed this, that. See, diabetes, not one word, all diabetes are not same. There are different stages of a problem. It is something like, if you are walking in a river, somebody is gone almost middle of the river and the water is up to the neck deep. Another fellow may be waist deep, another fellow is knee deep, another fellow is ankle deep. So that's how it is. What is that means? The guy is at the neck deep means is already pancreas is producing less insulin. So don't know how to improve insulin. There is no way. The damage has happened because of continuous misuse, abuse of the body. Pancreas works, and then it starts depleting its capability. So the best methodology is check your markers, find out how many daily wrong habits you have, stop them, and then accordingly, looking at it, you follow the dinacharya. So the best for diabetes is you must reduce or literally no carbohydrates. VRK diet, that's why it's very famous and very effective. Why? There is no carbohydrates. But it is very difficult to follow. Not everybody needs to follow that. But if you just focus, eat only 2 times, nothing in between 2 meals, and focus on this, you can improve. That's what it is, Anjan.
Thank you, sir.
So let's hope people understand this. And one more thing is, lot of they say Ayurveda word is reduced, homeopathy word is, somebody says he has gone to gym, somebody says I went to meditation, I went to Vipassana, Falana, Demaka, whatever you do, no issue. Don't have to believe me also. What is the best way to do? Check your markers, find out what is your HbA1c today. You follow whatever method you want to follow. Follow Mantina, or follow VRK diet or XYZ or my approach or anything. After 3 months, check yourself. As HbA1c has improved. Not only one HbA1c. People make the same mistake. They check only one marker. No. At least those 10 markers we talk about in our health score, we must check it. Have you improved your weight? Have you lost any weight? Have you improved your blood pressure? So it has come to normal or not? Then how is your thyroid level? How is your cholesterol level? How is your liver function? How is your HbA1c now? Okay, my HbA1c was 8%. Now it has come to 7.5, but something has gone up. Your weight gone up or BP is gone up. That's not the way to look at it. Then you see your D vitamin and B12 whether they are sufficient or not. Then insulin resistance. Anybody, let me tell you, 90% of the population are having insulin resistance. Why? Because the wrong habits, what they do. So understand this, you need the right knowledge and then the discipline. Then I think this Saidamam, wonderful place. Pause it so that we can cover the Saidamam. This is the Saidam temple where Shirdi Baba's temple. Activities of Gurukul activities, and this is the place where people stay. This is where the Swamiji stays there, and this is Goshala, and this is the Naturopathy hospital. This is Sri Datta Peetam. Swami Ramananda Prabhuji.
All day I can talk Mahashivratri. Okay now? The school will be open on